My name is Vinay Prabhu from the NYU School of Medicine, and I'm here to discuss our long-term outcome study of men undergoing radical prostatectomy and their level of lower urinary tract symptoms. So we studied 1,788 men who signed informed consent to be followed before and after radical prostatectomy over a 12-year period. Men filled out the AUA symptom score at baseline and at multiple postoperative follow-up time points and self-administered these questionnaires at home. We basically found that the number of men with clinically significant lower urinary tract symptoms or an AUA score of greater than 7 actually declined from baseline to 10 years post-operation. This is the opposite of what would be expected in the general population. We found that when we stratified the results based on preoperative lower urinary tract symptom level, and just looked at men who had clinically significant LUTS or a greater than an AUA score of 7, in those men specifically, lower urinary tract symptoms actually decreased post-surgery, and the effects of this surgery actually lasted until about 10 years post-operation, with almost 5 points of symptom improvement. In men with just clinically insignificant baseline LUTS, they actually, after an immediate increase in lower urinary tract symptoms after prostatectomy from 2 to 10 years, did not develop lower urinary tract symptoms, also the opposite of what would be expected in the general population. So in summary, billions of dollars are spent every year on medical and surgical treatments for lower urinary tract symptoms because they are a great detriment to quality of life. And radical prostatectomy, as we have shown, is actually a great benefit to people who present with lower urinary tract symptoms, and actually prevents the development of lower urinary tract symptoms over the long term. And this is a previously unrecognized benefit of radical prostatectomy.